Joining me now with this week's vet tip is Dr. Little of Shaker Animal Hospital. Dr. Little, thanks for being on the show.
Thanks for having me.
And today we're talking all about pancreatitis.
Yes.
So first things first,
Sure.
Where is the pancreas and what does it do?
Pancreas is in the abdomen,
Okay.
which I've come to find is not a common knowledge term from my mother. Your thorax is everything above your diaphragm. Your abdomen is below the diaphragm.
You got to clarify for mom sometimes.
Right. So you have your stomach is pretty high up in the abdomen, and then right behind it is the pancreas. It's an important digestive organ. It also has the function of regulating your blood sugar because it releases insulin. But in this instance, so for pancreatitis, we're more worried about its digestive functions.
So what happens when a pet gets pancreatitis?
So the pancreas, because it releases these enzymes that help digest fat and food in the intestines, when it gets inflamed, it actually starts releasing those little granules and it starts auto-digesting. So it starts digesting the organ itself, which is painful. And if you can sort of picture that, it leads to understanding a lot of the clinical signs.
Speaking of the signs.
Yes. So the signs when it's pain, because it's uncomfortable, it causes all this inflammation. And so they're usually painful right under the rib cage, I'd say, is a general location.
Okay.
Because it's near the stomach, it causes inflammation and irritation of the stomach lining. And so oftentimes they'll vomit, they won't want to eat. Sometimes they'll also have diarrhea. That's pretty common. Those are the most common signs: vomiting, anorexia, diarrhea, abdominal pain.
What causes pancreatitis?
So in dogs and cats, it tends to be different. Dogs, we know that there's a link between them having like a fatty or greasy meal and developing pancreatitis. In cats, there's a lot of people who think that it might be bacterial in origin, and then there's numerous other causes. So viral, bacterial, greasy food, so having to do with diet. And then most of the time, like I said, we don't actually find the underlying cause because the tests that we run to diagnose it don't always sort of give us that information. So there's tests that can help rule in pancreatitis. First of all, you must have the signs that go along with pancreatitis. That helps, so a good history from the owner. And then there's a couple blood tests you can run, and then imaging of the abdomen with the ultrasound. That can be really helpful in seeing the inflammation of the pancreas.
Now, when you say it could be caused by a bacterial issue, that, I just want to clarify, is it's all going on inside the pet, right?
So we don't think that it's something that they eat and then it crawls up into their pancreas. We think it's more an internal infection. Yep. To get a true diagnosis of pancreatitis, and 100% biopsy, so getting a tissue sample, would be something that you could 100% confirm, yes, it's inflammation of the pancreas. But that's such an invasive test, and it is really, when a patient is having pancreatitis, you don't want to put them under anesthesia, so that's not a test that anyone would often recommend.
How is pancreatitis treated?
So symptomatically, you treat with fluids, so IV fluids in the hospital is the most effective. Feeding them, because you want their gut health, so the cells in your intestines want food to be able to get healthy, so you feed them. Nausea medications, that's one of the big things, and pain medications, that's huge too. So those are sort of the mainstays. There's other treatments that your vet may recommend, just depending on case-to-case basis or what they think is the underlying cause. So antibiotics are sort of a question mark, but supportive care is really the best things.
Does it automatically mean your pet's going to have to stay at the vet for a long time if you think they have pancreatitis?
Not necessarily. There's different severities. So some pets are more severely affected. If they have more pain, more vomiting, and those things are harder to manage, then yes, it can be longer. There's rare cases where it can be fatal. I'd say most of them are treatable, and I'd say the average hospital stay is on average 3 to 5 days, but there's certainly dogs that when you catch it really early and hospitalize early, that can leave the hospital much sooner.
And how are you managing it now? Because it can come back.
Yeah, so in dogs, because we know that there's a link between like greasy, fatty foods, oftentimes in dogs especially, we'll switch them to a low-fat diet. In long term, that's something that's easy to digest, it's lower in fat, and it just helps decrease flare-ups, basically.
How can pancreatitis be managed in the long term?
Yeah. So in dogs, when we often change them to a low-fat diet, which often are prescription diets because we know how they're regulated, but there are other options, non-prescription foods. In cats, it really depends on the case. Oftentimes, long-term, I will routinely check blood work markers to see how their pancreatic levels are changing, just to sort of keep on top of it and make sure that there's not a flare-up. Cats, as I think a lot of people know, can hide their signs a lot longer than dogs can. So in dogs, it tends to be easier to notice a pancreatitis flare-up than in cats. So that's a tool that we can use.
So if you think your cat might have it, get them to the vet because they've probably been hiding it for a while.
Yeah, and have, routine exams. Keep a close eye on their appetite. That's super important just to make sure they're actually eating. If you have to separate your cats because you have more than one, to make sure they're still eating and not vomiting. Those are huge management things. Really just noticing what's going on can be really helpful.
All right, Dr. Little, thank you so much for being on the show.
Thanks for having me.
Our Vet Tip Again is brought to you by Shaker Animal Hospital, where they treat clients like family and pets as their own. Next up, a look at a few pet-friendly events happening around the Capital Region. Stay with us.